So what if the real reason you feel anxious, distracted, moody, like you can't focus on anything, has nothing to do with your mindset and everything to do with your metabolism? Like you can't talk your way or journal your way out of something that your body is hardwired into. In fact, the way you think, feel, and behave is not always psychological. It might have more to do with your physiology, like your mitochondria. So, if you have been working hard on yourself, going to therapy, doing all the things, and you're still not feeling better, this conversation with my special guest, Dr. Bret Scher, is going to help you maybe connect some of the dots that you have been missing. We are talking about metabolic psychiatry, brain energy, and this new theory that is revolutionizing our understanding about how to attain not just physical health, but also happiness in a very real way from the inside out. So today's episode, I think, is going to blow your mind, change the way you think about how you're thinking, how you're feeling. And I just am so excited to jump into this. So welcome, Dr. Scher.
Oh, thank you so much. It's a pleasure to be here, Lisa.
I am so excited to talk to you, seriously. And I have to tell you why. So it was last year. I like to read a lot. I read a lot of books, listen to podcasts, and came across this book, Brain Energy by Dr. Chris Palmer. And it absolutely blew my mind because as I was reading this, I was like, oh my gosh, we've been doing this all wrong, as he described this incredibly powerful relationship between mental health and metabolic health in a way that I had not encountered before. And as a therapist who has spent many years like in talk therapy, CBT, like working at helping people from that angle, that there has been a lot of missing pieces that unless we address these components, people are not going to feel good. And it just like, it clicked for me in such a way when I read this book. And that is why I'm like, seriously, so happy to be talking with you to bring your message, your mission, the work of your organization, Metabolic Mind, to more people, because this is a game changer.
Yeah, I mean, it really is. And, and Dr. Palmer deserves a lot of credit for, taking the step to put his book out there to really sort of spell out this theory of brain energy. But the funny thing is, and he admits this, he admits this openly, it's not a new theory, right? It seems new,
but it's new actually, to me.
it will. So what I mean by it's not new is ketogenic therapy and metabolic health as it relates to mental health and the brain in general goes back 100 years. Yeah. 100 years ago at Mayo Clinic, they were treating seizures with ketogenic diets. Well, maybe not 100 years ago at Mayo Clinic, but 100 years ago, they were treating seizures with ketogenic therapy. And then, fast forward to the 80s, 90s, 2000s, there was, research, randomized controlled trials showing ketogenic therapy and its effect on the brain for seizures. Well, it turns out you don't just have like a seizure part of the brain and a mental health part of the brain and a cognitive part of the brain. The brain's the brain. And when it comes to energy deficits in the brain, it can affect any aspect of the brain, just depending on maybe your genetics, your epigenetics, or, where in the brain is most pronounced. There are different factors that may influence that. But, just brain fog, just anxiety, ADHD, and then, of course, depression and bipolar disorder, schizophrenia. We're learning so much more about how the brain is such an energy dense organ, you could say, that any disruption in the energy production, utilization, and transformation in the brain can lead to any of these symptoms and diagnoses. And therefore, addressing the metabolic effects and the energy production in the brain and energy transformation in the brain can improve these. Now, it's not so clear cut, right? It's not that what you eat is going to completely reverse every aspect of anxiety, depression, and bipolar disorder. But we're learning it can have a dramatic impact and put into remission in so many people. So it really is a sort of groundbreaking new field that's rooted in a century of knowledge and treatment.
That is just incredible. And so, just for the benefit of my listeners, I mean, I've been reading up on you, like the articles and the books, but I would love it also if you could take just a moment to introduce yourself and like your organization, what you're up to, and if it's okay to ask. I mean, I love to ask my guests some more personal questions. Like, so you're a physician, and I'm so curious to know how you got on this particular trajectory. Like, what led to
Yeah.
metabolic mind and this whole area of specialty?
Yeah. So, I mean, it's a bit of a circuitous route. I mean, I'm a cardiologist. And so I did my training in a preventive and general cardiology fellowship, and, got out into the so-called real world and thought I was going to, reverse heart disease and just, make a big statement and prevent heart disease, and just wasn't having near the impact I thought I would, and had to sort of step back and say, well, why is this? And through a course of events, kind of opened a wellness center, Boundless Health. And then luckily was working with a friend of mine who is a coach, a health coach and personal trainer, and just a great overall individual who knew a lot about ketogenic diets. And through him, I learned about ketosis as a metabolic treatment, and was shocked actually to realize that there was research on this and that there was some clinical experience, but we're not taught this. We're only taught that keto is dangerous. Yeah. Right. Yeah. But from that and seeing the tremendous metabolic health benefits that you can get from ketogenic therapy, I was all in at that point and saying, well, people need to know about this, at least as an option, right? Doesn't mean it's for everybody. Doesn't mean everybody needs to try it. But for doctors to not even know it's an option is just criminal. So we need to learn more about it. And through that, basically became sort of an expert in metabolic therapy and ketogenic therapy. And then from there was very fortunate to meet the Bazzucchi family, Jan Bazzucchi, who started Metabolic Mind, basically with the goal for nobody to have to go through what she and her family went through. Their son, Matt Bazzucchi, has bipolar disorder. And despite, the family having time and resource to dedicate to his treatment, he just was not well. He could not get a treatment to get him back to his life. He was, he's been on 25 different medications. He's seen, dozens of different practitioners and tried TMS and tried, so many different interventions, and just, was kind of doing okay at some points, but wasn't well and back to his life. And then they found Dr. Palmer, and they found ketogenic therapy. And that just transformed his life. And as Jan says, she got her son back that she never thought she was going to see again. And he's living independently. He's working full time. He's, as he likes to say, he's the most sane of all his friends now, as he jokes around saying that. But I mean, and what she wants is for people to realize that this is an option, and not to have to spend the years and hours and hours and hours she spent trying to find a way to make Matt well again and help Matt get well again. And now, so as Metabolic Mind and Bazzucchi Group are funding the research to further explore this, with so many research projects going on now, some that have already been released and about 20 that are ongoing, and having a very forward-facing educational reach with our YouTube and our podcast and our website and our blogs, just however people consume media. We want them to learn about this and to be able to have, really intelligent conversations with their physicians about it. Because on the one hand, we're spending a lot of time and energy to educate those physicians, but we also realize there's sort of like a ground up education that not every doctor is going to see this. Not every therapist is going to see this. But if you walk into your doctor's office or your therapist's office and say, look, I just heard about this and read about this, and here's some of the research and here's some of the information, hopefully they're going to be curious enough to say, I want to learn more about that, to see if it's a way I can help people who I'm seeing and working with.
Definitely. And that you're making the research articles so readily available on your site. Because honestly, as a therapist, if somebody had walked in saying something like that prior to me learning about this, I would have been like, okay, let's take a look at the research. And so like, you're making it easy for people to do that. But like, I agree with you. You use the fact that more people don't know about this is criminal. And that is how I felt. And I have to tell you, when I was reading this, I actually felt a little bit guilty, and as that's going into my own stuff. I feel guilty about all kinds of things, but just like the deficit in my training around this, because I was thinking about like, oh my gosh, how many people have I worked with as a therapist over the years with depression that just like wouldn't budge, and here I am doing cognitive behavioral therapy, thinking I'm doing a good job, and like missing so much, and that people really need to know about this. So, okay, enough of this. Let's go into it. And could you start just by sharing with our listeners here, when you're talking about ketogenic therapy and the relationship on the brain, like just paint us a picture. What are we talking about? Let's start there.
So one thing we like to differentiate is just following a ketogenic diet versus ketogenic therapy. And we have, videos on our YouTube page about this. But the key being, when you're in ketogenic therapy, you're using it.
Forgive me. Let's just stop for a second. Let's assume the people listening to this do not know what the word ketogenic means. Like they haven't heard of any of this before. So let's back up a little bit.
So some people hear of a ketogenic diet as like a quote unquote fad weight loss diet, even though it's been around for centuries. But basically it's a very low carbohydrate diet. Low meaning like, 30 grams of carbohydrates or less for most people, whereas the standard American diet usually has 250, 300 grams of carbohydrates, right? So a big reduction in the number of carbohydrates. And what happens when you're eating that low of amount of carbohydrates is your body switches from burning glucose as the primary fuel source to all of a sudden burning fat as the primary fuel source. And in a way, it's a completely normal evolutionary trait, right? That if you're a hunter gatherer and you can't gather anything, and you can't, you don't have the berries or the tubers or the roots as your carbohydrate source, you need to burn something else. So you burn fat, either the fat that you catch, and hunt and eat, or the fat on your body. We have lots of stored body fat. Even thin people have lots of stored body fat that we can live off of. And we burn that body fat. So we switch our metabolism to burning primarily fat. And a product of that, when we're burning fat, is we create ketones. Ketones are just like a molecule in the body that you can use for fuel. And especially your brain can use it for fuel. And this is critical because your brain can also become insulin resistant and metabolically unhealthy, just like the rest of your body. And when that happens, when you can, start a diet that's going to help that, which a ketogenic diet absolutely does. It's probably the most effective dietary approach for improving metabolic health. But 2, you provide the brain with ketones to use for energy, so it's no longer dependent on glucose. So if you're having trouble using glucose for energy because of insulin resistance, metabolic dysfunction, you give the brain ketones. And all of a sudden, 70% of the brain can run on ketones, and that can completely transform how the brain is functioning. So that's sort of the general outline of what a ketogenic diet is. Now, it also helps with weight loss and metabolic health and so many other things, right? You can reverse type 2 diabetes, put type 2 diabetes into remission, reverse fatty liver, reverse polycystic ovarian syndrome, normalize blood sugar and type 1 diabetes. It has all these amazing effects just for blood sugar, insulin, metabolic health. And then it's got even more additive effects for the brain. So that's the effects of a ketogenic diet. And when we talk about ketogenic therapy, we talk about being in the state of ketosis for a particular reason, right? You're trying to treat a condition with ketosis and you're measuring your ketone levels. You have a goal for where you want those ketone levels to be. You have a goal for what symptoms you're trying to improve. That sort of encapsulates ketogenic therapy above and beyond. Some people say, oh, it's the diet where you eat a lot of bacon, a lot of steak, and a lot of butter. Well, it could be, but it doesn't have to be. And that's not the point. The point is to get into the state of ketosis to treat a medical condition. Again, whether it's type 2 diabetes, whether it's fatty liver, whether it's anxiety, depression, bipolar disorder, whatever the case may be, you can use it as an adjunctive therapy or sometimes even as a solo therapy to treat these conditions.
Thank you so much for explaining all of that to our listeners who, and I know that ketosis and ketogenic is in the air, it's in the zeitgeist, right? But to have somebody like you come and explain it and how it actually works and how your brain can use it as this alternative fuel. And it sounds like your entire body simply functions better in some ways on this
Yeah.
fuel, and that it can have a lot of just systemic positive health benefits. But I'm so curious to hear a little bit more about either what you have seen in your practice or the research that you've come across related to how a ketogenic diet and or therapy can help people with some mental health symptoms and things. I mean, you used like words around schizophrenia, bipolar disorder. So like there's some big fish in here, but also things like just depression, anxiety, ADHD. What does the research say about this, or in your clinical practice? What have you seen?
Yeah. So a couple interesting terms. One is that just the brain likes ketones is like a sort of very blanket statement, but it's kind of true, right? The brain just runs very well on ketones. The other thing is this term of serious mental illness, right? Serious mental illness is a clinical term, a medical term used for schizophrenia, bipolar disorder, major depression, schizoaffective disorder.
Yeah,
But it's also sort of, I don't know, almost judgmental because it means like everything else isn't serious. Well, absolutely not, right?
that's
The
fair.
person
That's fair.
who lives with anxiety, lives with depression, I mean, it's very serious for them. So I don't love those terms, but I throw them out there just to make sure we're all on the same page of what I'm referring to. So
I
the
hear you.
research so far has really focused on serious mental illness. It's focused on schizophrenia, bipolar disorder, major depression. But that doesn't mean by any means that it's limited to that. We have a number of case reports on ADHD, on anxiety, on OCD. There's a study right now going on PTSD, and one on ADHD. So, I mean, there's a lot that we're learning about this, but that goes back to the statement that the brain likes ketones, right? The brain is again, it's not like you have your schizophrenia brain, your bipolar brain, your ADHD brain, right? You might have different areas of the brain that contribute more or less, but the entire brain runs better on ketones, especially if you have insulin resistance and metabolic dysfunction, or any difficulty in transforming glucose into energy. So if you provide the brain with ketones, you're likely going to see some benefit regardless of what you want to call it deficit or dysfunction or whatever is happening in your brain, is you're likely going to see benefit. So a lot of people actually will use a ketogenic diet, ketogenic therapy, just for better focus, for better energy and being more cognitively intact and greater executive function. Now, I can't say we have a lot of research to support that because it simply hasn't been studied, but we see that time and time again with people who report that, with clinicians who see that with using ketogenic diet. So it sort of runs the spectrum, right, of just being able to think better and be crisper with less brain fog, to completely reversing and putting into remission schizophrenia, paranoia, bipolar disorder, and everywhere in between. So it really is pretty dramatic how the brain can respond to ketones and ketogenic therapy.
It really is. I feel like I need to make a confession. So last year, since I came across that book and reading about it, and then kept going with my own research, and I've talked about a number of times on the show. I personally struggle with an ADHD diagnosis. I don't want to say struggle; it's a superpower. It's good, but I have to manage it. And it was very interesting because when I learned about a ketogenic diet and the impact on cognitive functioning, I was like, well, I'm going to be my own biohacking experiment here. And I began personally experimenting with the ketogenic diet. And it has been absolutely fascinating. Like, I'm not allergic to anything. Sometimes I'll eat the candy and have a good time, whatever. But like, there is such a substantial difference in the way that my personal brain works for days after. That has just been fascinating to me. And so I could speak less to the mood disorder pieces of it. But on that level, I can attest, like, to anybody, if you're struggling with brain fog or ADHD or difficulty focusing, I'm starting to believe that this would just be a primary intervention because there's so many pieces, behavioral aspects of it, having to get more organized. Certainly medication can be part of it, but this is relatively simple it's good for your whole body. Like,
Yeah.
why would you not do this? So
Yeah,
that's wonderful.
I think that's a great question, right? The question of
Mhm.
why would you not do this? Because so many people
Yeah.
can see improvement. And the flip side, though, is for some people, it's not going to replace therapy, right? It's not going to
No.
replace the work you're otherwise doing. For a number of people, it
Mhm.
doesn't replace medications, right? It can be an additive, adjunctive therapy, and that's why we do recommend working with a clinical team if you're using it to treat a medical condition, right? If you're taking psychiatric medications or psychotropic medications for any reason, there can be an interaction, right? You can see a potentiation of the medication. All of a sudden, the dose that was working for you is now actually way too strong because you're on ketogenic therapy, right? That can absolutely happen, and you need to work with a clinician for that. So that's just one example, but it is a absolutely outstanding adjunctive therapy to other treatments, and I really don't. I do and I don't understand why people are hesitant to recommend it. The main reason is because people don't understand it, right? Doctors, clinicians, dietitians, they just don't understand it because we're not taught about it. We're taught about it, again, as the bacon and butter diet, which everybody assumes is unhealthy. We don't learn about it as a therapeutic intervention that changes our metabolism, changes our brain chemistry, and can be an absolutely life-changing therapy for so many people that improves our metabolic health. And, as a cardiologist, I come from the field that is most resistant to a higher fat ketogenic diet, because what's it going to do to your heart? It's going to give you heart disease and block your arteries and cause a heart attack and raise your LDL. No, there's zero evidence that actually happens with a ketogenic diet. But
why does everybody believe that?
Yeah. Well, because we take this data that we have from high carb, high fat, standard American diets, and we assume it applies to every version of a high fat diet, but absolutely not. So these observational studies in nutrition are such low quality evidence, and it's not the fault of the researcher. It's just the definition of that type of evidence is low quality evidence, but it's what we have for nutrition. So if somebody in one of these studies is eating, 50% carbs, 40% fat, and 10% protein, and that's considered a high fat diet compared to somebody who's eating lower fat and higher protein, whatever the comparison may be, that's not ketogenic. And it drives me crazy when people assume that it is. And the other is these quote low carb studies. And, low carb is if they're eating between 25 and 40% of their calories from carbs. Well, real low carb is like 5% of your calories from carbs. That's ketogenic, 5%, not 40%. But they equate the evidence as being the same. And they're like, see, keto is dangerous because these people who ate lower carb were less healthy. That's not science. That's not how science works.
Right.
But somehow people make that to fit their own biases and their own assumptions, I guess.
No, I get that. But that we really need to define the terms more clearly, because they're not comparing apples to apples. And somebody sitting down and having a hamburger and a bunch of French fries and a Coke, is that a high fat meal? Yes, it is. And yes, they're going to drop dead, like all of those things. And so you're saying that the research really needs to speak to what you are talking about, which is a healthy, high fat diet with really strict limitations on the carbs.
Because when you're
that be equivalent.
Yeah, because the physiology is completely different, right? When you're eating 40% carbs and high fat, you're burning the carbs first and you're storing the fat. When you're eating 5% carbs and 65% fat, you're burning the fat and you're not storing the fat, right? So it's a completely different physiologic state. So we can't assume it's the same. And the concern about cholesterol and heart disease, actually, there was just a study that was published that was really sort of groundbreaking and earth-shattering in the cholesterol world, that these people following a ketogenic diet who had LDL cholesterol levels in the averaging in the 250s, where anything above 190 is considered automatically dangerous, and optimal is considered 100, and they're up in the 250 level on average. It showed no more heart disease than a matched group that had LDLs of 130. And then if you follow them over a year, level of LDL did not predict any progression of heart disease. So the LDL was not reflective of their risk of heart disease. But yet that's sort of our biggest concern with people following a keto diet, which so doesn't really make much sense.
Yeah.
I really encourage people to go to, Metabolic Mind and look at our website and our YouTube page. We really highlight this research because it really should start to change the way we think about heart risk, cholesterol, ketosis, and how all that sort of interacts with each other.
Yeah. So interesting, isn't it? Like just the way the narrative can take hold that isn't really based on anything. And I love it that, again, you're making the actual research so readily available so that we can begin to have that counterpoint. Okay, so say we have an interested listener, one of our friends right now hanging out with us here, Dr. Bret, who's like, okay, you have got my attention. And this person might have ADHD kinds of symptoms or might struggle with mood, feel down sometimes, be more anxious than they would like, and would love to explore this diet as part of a whole, system of taking care of themselves. Can you talk about what this would look like? Like, where would they begin? I mean, certainly the resources on your website, but like paint us a picture of when people make the shift. What does it actually involve?
Yeah, I mean, you really want to be thoughtful about it because, look, any dietary change is difficult. Whether you're talking about going vegan or vegetarian or just reducing your calories or reducing ultra-processed foods, which absolutely everybody should do, right? And just eat healthier, whole foods. Even that in itself is challenging for some people to do. And it's because of the world we live in. But so the more you plan, the more you prepare, the more you act ahead of time, the more successful you're going to be. So if you want to go low carb or go on a ketogenic diet, you got to clean out the cabinets. You got to clean out the house, right? Because it's tempting. Those high carb snacks sitting there are very tempting, and we're emotional people, right? And that's where prescribing a diet is very different than prescribing a pill, right? You don't just pop a pill. There are emotions, there are cravings, there's history, how you were raised, all that sort of comes into
and
influence
it tastes
what we
good.
Yeah,
There's that
right?
part.
There's that part too. So the first is you really just have to do the pantry clean out, the whole closet clean out, and start to prepare and make sure you've got plenty of eggs and cheese and meat and veggies, right? Plenty of above ground, low carb veggies, and avocados and nuts. Like these are sort of the staples of a ketogenic diet. And there are so many websites out there. I used to be the medical director at dietdoctor.com, where they have so many recipes and meal plans and shopping lists and things like that to help someone. But it doesn't have to be complicated. You wake up, you have 3 eggs with some smoked salmon and leftover veggies from the night before with broccoli and cauliflower and spinach. And then, at lunch you have a Cobb salad maybe. And then for dinner you have either, name it, steak, ground beef, salmon, chicken thighs with, baked with cheese and more veggies and avocado and some olive oil, and boom, that's your ketogenic diet, right? Like that is not complicated. People think it sounds so complicated, but that's not. Now, you can make it complicated. You can make keto bread. You can make keto pizza. You can, make keto crackers. You can try and replace the things that you feel like you're missing. But by no means do you have to. And people talk about eating fat bombs and eating, all these high fat snacks. Most people don't need that because most people feel like they're not that hungry when they're on a ketogenic diet. That's the other thing. It's such a satiating diet that you feel like you don't need to eat as much. You don't need to snack. And that's another reason why it's probably so beneficial for metabolic health. So it really doesn't have to be that complicated. Now, that's coming from me. I'm a very boring eater. I could eat the same thing every single day and be perfectly fine. For me, food is kind of energy and it should taste good, but it doesn't need to be complicated. So for those people who like more complicated, there are plenty of websites out there that have very, very detailed and ornate recipes that are ketogenic.
Can I ask, are you on a ketogenic diet?
I am. Yeah, I have been for, I don't know, close to 15 years now, I guess. And I'm not on ketogenic therapy though, right? And so I do want to differentiate that. I'm not testing my ketone levels. I really don't care if I'm in ketosis anymore. I just think it's the right way to eat, right? Yeah. I don't eat I will never eat pasta or bread or pizza or grains of any kind ever again. But come summertime, I'm going to eat more fruit and berries, and I'm
Yeah.
not going to worry about it, right? And it's
Right.
just gosh, when the strawberries are so red and plump and delicious, and
I know.
I'm going to eat that, right? And that's fine, but that's not going to get me into trouble.
Well,
And yeah.
I mean, and tell me if this is too much. I'll stop. But I'm curious to know what did you notice about your own internal experience when you made the shift in your diet? I mean,
Yeah.
for me, it was pretty dramatic, but what was it for you?
Yeah, well, I was doing it more as like, if I'm going to give this to my patients, I need to learn about it. So that was
Yeah.
my motivation. And I had a young baby at the time, and
Mhm.
I guess I put on some of the father weight there, and that I hadn't really noticed, but all of a sudden it was gone. I was like, wait a second, what happened there? And all of a sudden I had more energy, and all of a sudden I was thinking more clearly, and I was less hungry. I would get those 10 o'clock snackies every single day, no question. And I would get the 2 o'clock, like, ooh, I'm starting to get a little sleepy here, every single day. Gone. Those were just
Mhm.
absolutely gone. And I do not miss them at all, for sure. Yeah. And so that was a lot of what I noticed. And then when I
Oh.
saw the effects it had on my patients as well, again, that's where I said, like, wow, everybody needs to know about this as an option.
Would you mind, in a certainly de-identified way, of course, to protect people's confidentiality, but would you tell us a story or three of transformation? I mean, what kinds of things have you seen in terms of particularly the way people are thinking, feeling, and
Mhm.
behaving when they make this shift?
Oh my goodness. You only want three, or you only
Uh,
want one or three? I mean,
300. How
that's
much
the
time do you have?
problem.
I
I
mean,
mean,
I'm curious to know, like, if there are any that really stand out for you as being like,
well, to
whoa.
be honest, the ones that stand out are the ones that I'm not involved in as the clinician,
I see.
because you can, as a doctor, look, I see patients, I've got a consulting business at lowcarbcardiologist.com where I see patients one-on-one, and I can affect one patient at a time. But I work at Metabolic Mind. When we get these emails from someone I've never seen, I've never talked to, I've never heard of, and I get an email like, thank you so much. My child is completely different now. They were nonverbal before, and now all of a sudden they're speaking, or they were,
That's amazing.
yeah, we couldn't get her out of the hospital with schizophrenia, and now she's back at school doing everything normal in college, and completely the child we thought we would never get back again. I mean, when we see these letters and these emails come in, that's what's just completely just blows my mind. And it's like, wow, someone I never met, I never talked to, I never laid eyes on. The work that Metabolic Mind is doing can have this impact on them is just, I mean, it gives me chills just thinking about it and talking
Yeah.
about it. Yeah.
That's amazing. That must be incredibly rewarding, but also speak to the power of this in
Yeah.
quite
Yeah.
dramatic ways sometimes.
Yeah. And when I started out doing this as a doctor, over 15 years ago, it was the weight loss. It was the
Hmm.
getting off your diabetes medications,
Hmm.
getting off your blood pressure medications, and completely normalizing your blood sugar and your blood pressure and your weight, and feeling good and moving around again. Like, those were dramatic. Those were dramatic, super dramatic. But I think the mental health impacts are even more dramatic.
Yeah. Wow. Well, and also, I mean, there are a lot of clinicians such as myself who are maybe like bailing out the boat as fast as water's coming in. I mean, to be doing therapy with people, and sometimes it's very expensive, and it's a lot of time and energy, and then to have them going home and ingesting substances that are like creating inflammatory responses in their brain that
Yeah.
make it impossible for them to experience benefit
Oh,
from the
that's a great
things that we're
point.
talking about sometimes. Like that's a problem. um and actually, on that note, so we talked about ketones and the different like fuel processing
Mhm.
systems. Is there, in your experience or in the research, a role of inflammation in the way that the brain functions? And if so, can you speak a little bit to that as well? My understanding is that a ketogenic diet will lower inflammation, but
Yep.
what is your take on that?
Yeah, absolutely. I mean, research's been pretty consistent on that,
Hmm.
whether you're measuring sort of systemic inflammatory markers like CRP, or the group at Verta Health even measured just like white blood cell count, or this NLRP3 inflammasome, which is an inflammatory marker. But no matter what you're measuring, inflammation tends to go down with ketosis. So whether it's the improved metabolic health, or getting rid of inflammatory foods, or the direct effect of ketones, it's likely a mixture of all of that that helps reduce inflammation. And we know neuroinflammation is a big deal for it can contribute to epilepsy, it can contribute to serious mental illness, and it can contribute to any sort of brain energy deficit and dysfunction. And so by reducing that neuroinflammation, we're going to improve brain function. It's very clear cut. Now, how much is that versus how much is other impacts? And this is where sort of, I think some doctors or researchers maybe don't like ketogenic therapy, because we're used to this sort of razor's edge approach. Like, your serotonin's low, we're going to give you, or we think your brain serotonin's low, so we're going to give you a selective serotonin reuptake inhibitor, right? So is that really the way it works? But that's the mindset, right? Research says we think we have a deficit, let's find a pill to address that deficit.
Right.
Ketogenic therapy has so many different effects that it's not sort of, this is the one effect of ketogenic therapy. So neuroinflammation is one of those effects, but it's probably not the only effect. And who knows if it's even the primary effect. So that's one reason why I think some people also are a little hesitant. It's like, well, I can't do all these things, right? How can it put schizophrenia into remission and put type 2 diabetes into remission? Well, that doesn't make sense. Well, it does when you think about the metabolic health dysfunction that can contribute to both of those, and the systemic or neuroinflammatory components that can contribute to both of those, right? When you think about that connection, now all of a sudden it makes sense. But on first blush, you can see how some people are like, wait, no, that can't be.
Well, I mean, just again, for the benefit of the conversation, how would you describe and articulate that connection?
Yeah.
What is the connection?
The connection is metabolic dysfunction. If you really want to kind of boil it down to one thing as much as possible, with insulin resistance, metabolic dysfunction, our body is taking in nutrients and not efficiently transforming it into energy because either our cells aren't responding to insulin very well, right? So we need more and more insulin, and that causes a cascade of detrimental health impacts. But also makes it so our cells can't transform glucose for energy efficiently. And the exact same thing can happen in our brain, that we're not transforming glucose well enough for energy. So it's this concept of metabolic dysfunction, insulin resistance, that ketogenic therapy absolutely addresses. So that would be sort of the elevator pitch to how it works. But some of the downstream effects are inflammation, right? Some of the downstream effects are high blood pressure. Some of the downstream effects, right? So there are other downstream effects that are also impacted.
So, question: if somebody was dealing with a inflammation response and maybe was kind of cruising under the radar, don't have high blood pressure, they're not diabetic, they're just kind of like walking around in the world, eating the Doritos, drinking the Cokes like everybody else, and they're having this inflammatory response that is impacting them, and maybe they don't like realize it yet. What would be some of the things that you would look for, maybe ask about, to identify whether there was brain inflammation going on?
Yeah, I mean, that's detecting brain inflammation with clinical tests is pretty hard. And that's part of the difficulty, right? There's not like a test for brain inflammation, right? And we have tests for systemic inflammation, whether that's like a CRP blood test inflammation.
I mean, in terms of like somebody's inner experience, what might you expect?
So inflammation is a very general term, and that's, I guess good and bad, in that it can capture a lot of different things, but it also makes it very difficult to define. Like, inflammation in your joints is kind of easy to feel, right? Your joints ache and they're a little swollen, and, that's an easy thing for inflammation. Brain inflammation, to be honest, is much harder, but brain fog, people understand brain fog pretty well, or just sort of confusion, not feeling as sharp, memory not being as good. It's not that those are absolutely 100% due to brain inflammation, but those can be a result of some inflammatory process in your brain. And again, that's this concept of, it's not one thing, right? That frustrates some people. It's not this one thing, but that can all be interrelated.
Yeah. And it's systemic, it's your whole body is having a response to this, and it could show up in a lot of different ways. But thank you. I just wanted to give some visibility into what this experience feels like for
Mhm.
people. So, okay, another question for you. I am curious to hear your take on the role of some of the drugs that have come out in recent years. So like Ozempic would be
Mhm.
an example of this. And I ask because I have started encountering therapy clients who, for a variety of personal reasons, have started on these drugs and who
Mhm.
will report back in 4 or 5 weeks and be like, oh my gosh, like they are reporting reductions in anxiety,
Yeah.
depression, feels like there's just this like quietness in their brain that is
Mhm.
very unfamiliar to them sometimes.
Mhm.
Have you noticed this in your practice or heard of this happening? Because it made me wonder if some of these drugs are having a similar-ish impact on metabolic functioning that we can also certainly create through diet, or is it a
Yeah.
different thing that's happening?
And that's a great question. And I'm not sure anybody truly knows the answer. So there are GLP-1 receptors, in the brain. So,
Yeah.
it could be a direct effect, but it's also a metabolic effect, right?
Yeah.
GLP-1s help you lose a lot of weight and help you improve your metabolic health. At least in the short term, we know that that's the case. So,
Mhm.
you can see that impact that way.
Yeah.
And now I have done a couple videos that, interestingly, there have been reports of increased suicidality with GLP-1s, which is
I didn't know
super
that.
concerning. But it's like it goes both ways. Some people feel dramatically better, improved depression, improved anxiety, improved ADHD, improved mental health, and then I would say probably a smaller percentage. We don't know for sure, but it seems like a smaller percentage can feel much worse. So why is that? Now that's something we need to learn
Well,
more
but
about.
that actually makes sense because if you do have depression and then add a lot of energy to depression, that can be a recipe for suicidality. But interesting, like maybe there are different causes for the origins of the
Yeah.
mood
Yeah.
stuff.
Yeah, so
Wow.
GLP-1s absolutely
Mhm.
could be a potential intervention to
Yeah.
help someone with metabolic dysfunction who has a lot of weight to lose to improve their metabolic health. Now, what gets me though is when people say, "Okay, we're going to go to the medication now because we've tried everything else." But
Mm.
they haven't tried ketosis because it's not sort of in their wheelhouse. It's not what they're thinking
Yeah.
about. It's not what they're taught about, right? So if you want to try other lifestyle interventions first, you got to try ketosis before you say you've
Right.
tried everything else. And a lot of doctors will use ketogenic therapy and GLP-1s together. So you can use a lower dose of the
Mhm.
GLP-1s plus ketogenic therapy. They're probably synergistic and can really work well together. And then there was even a study of using ketogenic therapy to help people taper off GLP-1s, that they saw the benefit
Mm.
from GLP-1s. But you don't want to be on an expensive medication with potential side effects forever. So they transition them to a ketogenic diet, which helps them take the medication off and not
Yeah.
regain the weight, right? Because that's the problem with
Right.
GLP-1s is you tend to have tremendous weight gain, rebound weight gain, sometimes even more than where you started. And
Mm.
you lose both fat and muscle mass. And frequently you gain back predominantly the fat mass
I
and not so
see.
much of the muscle mass. So it is a little problematic. So there is
Right.
definitely, a use case for both of them together.
Yeah, but you're also saying that this is essentially a natural food-based approach that in some ways can replicate the impact
Mhm.
of these drugs that
Yeah.
can be expensive, that can have side effects. That's
Yeah.
wonderful. Okay, lastly, and so I don't know if this is an appropriate question to ask you, given your area of specialty, but I do think that this is important for people who want to implement this in practice in their own lives. So, and just transparently, I mean, a big part of my background, I'm a marriage and family therapist. So I always think about these things from a relational stance as well as, just what to do. And I am curious to know if in your organization or the professionals that you've talked about have thoughts or advice or recommendations for how to make some of these changes as a family. So like you yourself mentioned being a dad, I too have 2 kids, and I've had moments, Dr. Brett, I have to tell you, when like I'm sitting there with my egg and avocado, like feeling good and watching my kid eat macaroni and cheese and being like, oh my gosh, like this
Yeah.
is not good for them. But like I have to like pry it away from their cold, dead hands. Do you know what I mean? Like other people in my family are not not always receptive to these ideas. And certainly I am not going to force food choices on especially children, because that can have like other unintended consequences.
Right.
But for couples, for families, like one of the things was like throw everything out. I was like, that would work in my house. Although I have been making small changes. We're like on gluten-free bread, like we're getting there.
Well, and it comes down to why, right? Why are you making the dietary change? So if you have a teenager at home with bipolar disorder that you are trying to help, then the whole family needs to make the change to help that teenager. That not has to, but I certainly recommend that the whole family get on board and lead by example. If you're doing it yourself, like if I'm doing it to help lose weight or improve my metabolic health or whatever, that doesn't mean my teenager needs to do it by any means. So for me personally, look, my teenager, he's a wrestler. He's burning like, I don't know how many hundreds or thousands of calories per day. So if he's going to eat his bagel in the morning before he goes and wrestles for 3 hours, I'm okay with that. He does not need to worry about that, right? Like that's not his concern. But again, what is the purpose? So sure, anything you do together as a family is going to work better, I think, for the individual, unless it's a complete struggle and there's really no need for it. So educate. He knows more than anything the role that carbs can have and sugar can have and ultra processed foods can have. But he also knows that he's, a teenager burning so many calories and as healthy as can be, and that's okay. So it's that balance,
Yeah. Got it. No, thank you for speaking to that. And then just one more thing. What came up for me as you were talking, particularly this idea about a family making deep systemic changes for the purpose of helping particularly one family member who is not okay. It made me think about the struggles that so many families face with either major mental illness in a family member, a loved one, autism spectrum disorder. Has a ketogenic diet been shown to be helpful for autism spectrum disorders?
So I just released a video, an interview I did with Dr. Elena de Keister from the Netherlands, and she is studying ketogenic diets for autism spectrum disorder. And there's definitely some clinical experience and mechanistic theories as to, yes, it is beneficial, but we obviously need more experience and more research. But I highly recommend anybody who's interested in that to look up Elena de Keister and my interview with her at Metabolic Mind. It was really eye-opening.
I'm going to watch that. That sounds super interesting. Okay, and then lastly, so recommendations. So you may have many interested people listening to this who are like, yes, I'm going to do this. It's going to help with my brain fog. I might feel more clear, more calm, be in a lifted mood, all the good things. And there also may be quite a few people, Dr. Bret, listening to this who are thinking of a family member, maybe a mom or a dad who is not okay metabolically, and maybe who is experiencing mental health symptoms, or even a good friend, and they're like, oh my gosh, I need to help my person understand that this could be a path to healing. So I know you have a ton of resources that they could potentially put in front of someone, but thoughts about how to broach this conversation in a way that wouldn't elicit like just a ton of defensiveness, or if there's a particular podcast episode or YouTube video that would be like a soft kind of gentle place to start, like how would somebody begin to broach this?
It's a great question. And it really sort of depends on the person, right? Are they a science-minded type person where you kind of lead with the scientific theories, or are they more of like the emotional connection and they want to see someone else's sort of personal experience and be like, oh, wait, maybe that could be for me too. So we try to really highlight both of those with all our content, the individual experiences, the science, and you mentioned someone's parents. So if it's someone who's worried about sort of cognitive decline as they age, I did an interview with Hal Cramner, who runs a few assisted living facilities or retirement facilities, where he feeds them meat-based ketogenic diets, and they do amazing how well they improve physically and mentally. So, if it's someone's approaching that realm of their life or that period of their life, to have them listen to that interview would be pretty eye-opening, because his whole point is I want people to get out of my facilities, right? I don't want people living here forever and just kind of going down and down and down in my facilities. I want them to improve and get out. And that's what, so someone could watch that and be like, wow, I never want to be in one of those facilities. So maybe following those types of lifestyle changes can help me, right? So it depends where they're at, how to approach them. So we try and provide any of those resources depending on who the individual is.
Yeah. Okay. And then I'm so sorry. I'm going to let you go, but then I have one more question. Okay. Just another thing. This is a curiosity question. So obviously there's a lot of great research on the validity of a ketogenic diet and all of the health benefits. And also there seems, at least from what I have seen, and I'm not the expert, which is why I'm asking you, seems to be some pretty substantial evidence that can support high quality plant-based diets as having at least some of similar health benefits. So thinking now like the work of, not the work of, but like Michael Pollan has reported on some of these things and others. How do you evaluate that research compared to the ketogenic diet research?
Yeah. Well, so the first thing is, look, any diet that compares to the standard American diet is going to show improvement.
It's going to look great.
Right?
Okay.
Any diet that you're going to get rid of some of the ultra processed foods and reduce your calories and eat more whole foods is going to show benefits. So no question. Like if you want to try a plant-based diet and you're on the standard American diet, you're going to likely feel better. Now, a lot of it depends when you're talking about the research though, and this is the problem. So what is the quality of research, right? Is it an observational study where the people who followed the plant-based diet were just much healthier at baseline? That doesn't tell you a whole lot, right?
Yeah.
Was it comparing it to a standard American diet? Okay, it's better, but that doesn't tell you. So we don't have that keto versus plant-based comparative diet. And actually, Dr. Chris Gardner published his twin study from at Stanford, where the conclusion was supposedly that a plant-based diet is much healthier than another twin following another diet. And we reached out to him and we're like, you know what, interesting study. Help us do the plant-based keto diet. We want to do this study, but we didn't hear anything back from him, unfortunately. One of the problems with that study was like, I think of all the people, only one person on the vegan diet said that they would continue it long term. So there's concerns about that, but that's sort of a distraction, not to answer your question. But the point being is, yes, absolutely, people, and you can do a vegan keto diet too, right? You can do a plant-based keto diet. They're not mutually exclusive, so that's really important too.
Fantastic.
So absolutely, people can feel better. Now we need the more direct comparison, because what benefit does the ketones have, right? And what about protein? Can you get enough protein on the plant-based diet? Certainly bioavailable protein to improve your metabolic health long-term. There are certainly concerns, about that. Absolutely doable, but it just takes a little more attention. But we need sort of the more head-to-head studies to say, is one better than the other? But we can clearly say either one is better than what most people are eating right now.
Okay. Well, that would be very exciting. Oh, the suspense. Okay. I'm going to wait for that one. Well, thank you so much. This has been such a fascinating conversation. I'm so happy to be connected with you. And I would love it if you could just take a few minutes and talk about some of the different educational resources that you have available for people, where they go to find it, how to follow you on YouTube, on the socials, and keep this conversation going.
Yeah. So, a lot of our content, our interviews, and our educational videos are at our YouTube page for Metabolic Mind. We're on X or Twitter at metabolic_mind. And of course, our website at metabolicmind.org. Those are sort of the best places to go check all that out. And then from a cardiology standpoint, I'm also at lowcarbcardiologist.com. But not so much information there. More of the information is on the Metabolic Mind side of things.
Amazing. Well, so much good stuff. I am going to be binging your podcast for the next couple of weeks, like it was my job. I can't wait to hear them. I will definitely be sharing them with people. And so thank you again for this. This was really a very enlightening and interesting conversation. So I appreciate your time today.
Yeah, I appreciate the opportunity to speak to your audience, and hopefully they learn something and something will help them from this. So I appreciate the opportunity.